Well, June is Men's Health Month. And during this month, medical professionals all over the country encourage men and boys to be productive in their health by implementing healthy living decisions. Well, this year, the U.S. Department of Health and Human Services Office of Minority Health is focused on improving health outcomes for men of color. And in case you did not know it, 1 in 6 Black men will develop prostate cancer in their lifetime. Now, that's according to a new study. Research from the American Cancer Society shows Black men are more than twice as likely to die from the disease than their white counterparts. Also, new studies out show that on average, men in the United States die nearly 6 years earlier. Yes, your husbands are likely to die 6 years earlier than you are, and they are, men that is, are at higher risk for many serious diseases, including heart disease, lung cancer, and HIV. I also saw a study out that says that Black men should begin thinking about their health, obviously at much earlier ages, and that the number one killer, I don't know if you know this, the number one killer of Black men is heart disease. 24% of all deaths of Black men are related to heart disease. Cancer comes in a close second. I am so excited to be joined in this hour by a very prominent physician, oncologist from one of the nation's leading medical institutions in this country, Johns Hopkins University, because this doctor, he's an oncologist and an epidemiologist. His name is Dr. Otis Brawley. He knows a whole lot about prostate cancer, what men need to know about prostate cancer in terms of getting checkups and preventative health care measures that men can take. So I'm going to talk to Dr. Brawley for this entire hour about men and Black men and how do we help our brothers, our fathers, our uncles, our sons, our neighbors, and even our coworkers take better care of themselves. You know, we see men, many of them going to the gym, but I unfortunately just lost a friend, and a Black male friend. And in talking to his wife, learned that he had not been to the doctor in I was going to say a decade, but that's not accurate. She told me he had not been to the doctor in 2 decades, 20 years. I could not believe her. I was incredulous. I kept saying, no, that can't be true. And she's like, it's true. And I know he's not alone. I know that there are many, many Black men who don't go to the doctor, even when they have good health insurance, even when they have access to good quality medical care. I'll talk to our resident expert in this hour about why and what we can do to change that so that people like my friend don't die prematurely. Thank you so much, Dr. Brawley, for being here. Thank you for your work. And I was not kidding. A friend of mine just passed away, and his wife told me that he had not been to a doctor in 20 years. I almost fell out of my chair. I could not believe her. She insisted that it was true with one caveat. He did have a health scare and he had to go to an emergency room, she said, about a year ago. But he then never followed up after that emergency room visit, even though he was told in emergency room that he had some chronic underlying diseases that were treatable. So I know as horrific as this story is, this could not be a one-off. How frequently are you in contact or seeing Black men who literally haven't been to see a doctor in decades?
It's actually common among men. By the way, thank you for having me. It's wonderful to be with you. And I went to the college at the University of Chicago as well.
Okay. So you were super smart. Okay, I got it.
The phenomenon that you're talking about is incredibly common in men of all races, but especially in Black men. If we had an ideal healthcare system, each one of us would have a health coach. It would be a physician or a nurse practitioner, a physician's assistant, whose job it is to meet with us once a year, perhaps, and work on things to help keeping us healthy. Unfortunately, our healthcare system is really a sick care system where we only fall into it, for the most part, when we get sick, and many of us have sometimes very reasonable reasons to be suspicious of healthcare and then not to want to engage. And the suspicions are, for Black men, we have oftentimes not been told the truth. There's some things out there nowadays, like with prostate screening, where we're not told the truth. We're not allowed to make decisions about our own bodies. We are things are dictated to us. And unfortunately, until our healthcare system changes, we're not going to have Black men especially engage in it and benefit from it in large numbers.
So, doctor, okay, you said one of the reasons that Black men don't engage in our healthcare system is because they've been told lies about their health, about the system in general. What are some of the other common reasons that you hear from Black men as to why they don't get regular checkups or don't literally will go a decade before going to a doctor?
Well, many just do not focus on health, and some just believe that they're immortal. One of the things that I have worked long and hard on is we need to start getting people thinking about health when they're in grade school. I mean, many issues that we see in our 50s, 60s, and 70s start when we're in third and fourth grade, believe it or not. When we talk about smoking, the average age in which a Black American starts smoking in the United States, a Black American male, is actually 13.
Wow.
Okay. And the second most common age for Black men is 14. Okay. And so we need to start focusing on health, which really is risk reduction or prevention of disease. We need to start focusing on telling people the truth and being trustworthy. I can give you examples of things that are commonly done in medicine right now that are wrong, or they are people putting their opinion into a man's personal decisions when we really ought to respect that man, try to educate that man, and then let that man make his own decisions. And then we'll have much more engagement in the healthcare system.
Yeah. How have you been able to inspire, encourage, or urge someone like this, this hypothetical person we're talking about that hasn't been to a doctor for years, that has so much distrust for the system, who believes they are invincible, who believes that, I can go to the gym and lift 200 pounds, I can run 10 miles a day, so why do I need a doctor? How do you convince that person that despite, maybe appearing to be very strong and in good health or good shape, that they could have underlying health diseases?
If they have available to them someone, a healthcare professional, who they start trusting and start realizing this is somebody who is not going to dictate what I should be doing, might suggesting is fine, but respecting that man's opinion about what he wants to get, then sometimes people will engage. Sometimes mass education, especially regarding smoking, diet, physical activity, those, by the way, the major causes of people developing disease in the United States are, number one, smoking, and number two, we call it energy imbalance. Some people call it obesity, but it's actually consumption of too many calories, not enough exercise. And then if you consume too many calories and don't burn them off, you store them. That's obesity. It's really a three-legged stool, and that's the number two cause of cancer. But if you look at smoking and energy imbalance, those are the causes of coronary artery disease. Those are the causes of diabetes as well. By the way, in the country this year, about 50,000 Black men will die from cardiovascular disease. Wow. About 10,000 Black men are going to die from lung cancer. About 7,500 or so are going to die from prostate cancer. And sometimes we in medicine focus so much on the prostate cancer, we forget about the cardiovascular disease.
Mhm.
And some of our messages in prostate cancer, especially prostate cancer screening, relate more to what the informer or the physician believes as opposed to what is scientifically known. And actually, you can go online to a number of organizations. Let me give you an example of how we mislead men and indeed merit their distrust. A lot of folks out there are encouraging Black men to go get screened for prostate cancer. You're a fool
Mhm.
if you don't get screened for prostate cancer. I heard that just yesterday. I, I'm not against prostate cancer screening, but when I look at the 12 different organizations in the United States, Canada, and Europe that have made comments about prostate cancer screening, let me read for you what the American Urological Association says. They say, given the uncertainty that prostate cancer screening results in more benefit than harm, a thoughtful and broad approach to prostate screening is critical. Patients need to be informed of the potential risks and the potential benefits of testing before it's undertaken. Okay? Prostate cancer screening may save lives.
Right.
It might be good for a man to go through, but the organizations say, tell that to the man and let him decide. When we start saying you're a fool if you do not get screened, we're not letting the Black man decide.
Well, let me ask you this though. If someone says you may benefit from a screening, it suggests that you may not.
That's right.
Yeah, right. And that you have a choice. And the choice, it doesn't suggest to me that the choice is that if you make the wrong choice, it could be deadly. I guess that's the problem I have with what you're saying.
In both directions, by the way. In both,
right. So,
I've seen
am I,
patients.
hold on a second. Am I really making a choice if you don't tell me, here are the consequences of you not getting, if you don't get the screening and it turns out you do have cancer, it could lead to, you being debilitated. It could lead to your death. Then it's a little different when you tell me to make a choice. But if you just say it may or may not benefit me without telling me the dire consequences, then am I really making an informed choice?
Well, there's a group of men who get screened, who get diagnosed, who end up getting needless treatment because there's some prostate cancers that don't need to be treated, but we in the United States tend to treat all of them. And when we talk about something like radical prostatectomy, surgery to remove the prostate, 1 out of every 200 men who get that surgery die from the surgery, not from the cancer. So yeah, you can die either way. And the only difference that I'm saying is the experts in screening have said, we don't know if all men should get this. A guess needs to be made taking into account the concerns of the man and let that man make.
Wait a minute. What are the concerns? And I hear you saying the surgery could be dangerous, but what are the concerns, legitimate concerns that a man could have about a screening?
Okay, all right. There are men who will get screened. By the way, one of the great problems in the United States for poor people, not just Black people and not just men, is a lot of people get screened, have an abnormal finding, and get no follow-up evaluation. And you need to be diagnosed and treated in order to benefit from the screening. Right? And one of my more quoted papers is 7% of Black women who are diagnosed with a curable breast cancer in Georgia get no treatment in the first year. But in any,
that feels like you're conflating to me. So I understand the problem we have in our healthcare system of not having healthcare available to everyone, and people who are poor, people who don't have good health insurance may get a screening and don't get the care that they need. But I'm still grappling with what is the issue with getting a screening.
The issue
somebody may have a legitimate concern about.
The issue. Well, number one, we don't have a good study to tell us if screening saves lives. That's what the American Urological Association is saying. We want to get screened to save our life. We don't know that happens with prostate screening. That's what the organizations are saying. Now, my point, and again, my point is not against screening. My point is when the experts say that the individual man needs to make a decision, and I'll admit it's an educated guess as to whether or not he should be screened, and the system makes the decision for that Black man. The experts say let the man make the decision.
But wait a minute. Again, no, I'm grappling with this, Doc.
Sure.
Let the man who has no training in oncology, has no training in the workings of the prostate, has no training in medicine. So when I come to you as a doctor that has all of the training that you have, or a urologist or someone else has, I'm not looking for you to tell me to make the decision about my screening. I'm looking for you to tell me, based on all of your experience and all of the literature and the scientific evidence, yes, make that educated guess for me. Now, obviously, I can reject your recommendation, but I don't want to go to a doctor and him tell me, or he or she tell me, to make such a big decision.
Well, here we have the exact problem here. 12 organizations of experts in screening. Remember, doctors who are doing this screening are not experts in screening. 12 organizations of experts in screening have looked at the scientific data, and they have said that they cannot make the decision that all men should be screened. Now, one of those organizations, two of them, the American Cancer Society and the U.S. Preventive Services Task Force, they've looked at the breast cancer data, and they've said, we've got really good data to show breast cancer screening saves lives, so we recommend women get it. But when they look at prostate cancer, they say it might help men, it might not. And I'm really saying, brother, you got to live with the end result. So you make the decision. Better me make the decision than you. If you get screened and diagnosed, you may very well end up with treatments that can kill you. You can end up with treatments that cause impotence and incontinence and other issues.
Yeah, but you also could end up getting treatment that could save your life. I know so many men, and of course, this isn't scientific, but men who've had prostate cancer, those that did get the treatment early on, have gone on to live long, healthy lives. But I also know men who have died because they got diagnosed too late, because they're like my friend's husband, who never, they didn't go to the hospital or doctor, or shouldn't say the hospital.
You're struggling with what you believe versus what you know.
Well, no, I'm struggling with the reality is there risk associated with everything we do in our society. And if it's a test that is paid for by your health insurance, that's pretty non-invasive, then I would think that there would be no reason for people not to get it if there's even a slight chance that that test could save your life. Dr. Brawley, I saw this report about the top 10 causes of death for Black men, and it listed, as you said earlier, heart disease is number 1, cancer is listed as number 2. I was surprised by number 3, and you tell me if this is borne out by the data you've seen. It has Alzheimer's disease as number 3, and stroke is number 4. I was a little surprised by that ranking of Alzheimer's as 3 and stroke as 4. Is that what the data really shows?
Yes, unfortunately. There's also, by the way, a link between Alzheimer's disease and diabetes, which is rampant in the Black community as well. But yes, that is what it shows. Now, with Alzheimer's disease, we don't have a preventative yet. However, again, I just said it's linked to diabetes, which is linked to a lot of social issues, and it's important. And this is another reason why people don't want to go to the doctor. Sometimes when we start talking, it sounds like we're blaming them for some issues. A lot of these are social issues that cause, for example, the obesity epidemic in the Black community. We tell people eat 5 to 9 servings of fruits and vegetables per day. Well, many people live in food deserts where there are no grocery stores, or food swamps where all the stores that sell food sell lousy food. If you live in many of the inner cities, I live in Baltimore, we Many of the stores they don't carry fresh fruits and vegetables. There are no chain grocery stores. They're mom and pop places that have canned goods and have other things that don't spoil. And those are terrible foods for people to be eating. Processed foods tend to be very high in calories and terrible in nutrition. And these are all setups for obesity and a number of those diseases, cardiovascular disease that you just talked about.
Yeah. So, okay. So thank you. Alzheimer is number 3. They have stroke is number 4, and then horribly, number 5 on this list is homicide, which is, that's just crazy. But then diabetes shows up as number 6, and then number 7 is chronic lower respiratory disease. What would that be? That chronic lower respiratory disease?
It's chronic lower respiratory disease. You and I know of it as bronchitis and emphysema.
Oh, okay. Then they have kidney. Hypertension. Very shocking to me. It's number 10.
Now, some of these diseases cross over. Okay. The most common cause of kidney disease in the United States is actually diabetes. And hypertension and diabetes is a real, they come together and really help us have kidney disease. Most common cause of stroke is hypertension. And so some of these things can sort of overlap. They all have, if you go back to, smoking, and that 3-legged stool I was talking about, too many calories consumed, not enough exercise, and then storing those calories as obesity, energy imbalance. You get rid of a lot. You really start preventing or reducing risk is a better term for a lot of these diseases. And much of this starts in childhood, teen years, and it's a life of bad eating and smoking that causes a stroke in a 55-year-old or a 60-year-old, or causes diabetes in somebody who's 40 or 50 years old. It's not, and the other thing, of course, is it's never too late to start doing the right thing. Doing the right thing frequently requires several years in order for you to start seeing good results. And I also started out by saying many people are in a social position where these things happen to them, not because they want them to happen to them, but because they have no control.
So, doctor, we've seen Ozempic and other weight loss medications, Wegovy, and some others in the news a lot, obviously related to, high-profile celebrities like Oprah Winfrey and others. But I haven't seen these medications talked about in the context too much of men. What I've seen has always been literally like women, who want to be thin, want to wear certain kinds of clothing, want, their bodies to look a certain way. And, health gets thrown in there too. But a lot of it seems to be about, physical appearance. Are we seeing these weight loss medications being prescribed at the same rate as they are for women, for men, or maybe they're even being prescribed more and we're just not seeing the men in these ads or in the pop culture? So with men and weight loss medications.
Interestingly, I just saw a Wegovy commercial, and the shocking thing was the lead actor, and it was a black man. And it shocked me. It shocked me. One of the problems with these new drugs, and we've only had these drugs for 6 to 8 years, so we don't know what the long-term effects are going to be. But we do know 2 things. The first is they're incredibly expensive, and many insurances will not pay for them. They cost $1,000 to $1,500 per month, and many insurances will not pay for them. Sometimes people will have co-pays, 20% co-pays, and for many of us, $300 a month for a $1,500 drug is still quite expensive.
Right.
The other issue that we already know is that if you stop taking these drugs, people start gaining weight again. And so people who go on these have to stay on them long term. And then the other issue is we don't know what 20 years of taking any of these drugs means to an individual, because we've not had those drugs for 20 years.
So is So to answer my question, are we seeing fewer men be diagnosed, these drugs being diagnosed for fewer men, or is it not really a difference between men and women?
We're seeing fewer men get these drugs prescribed, and the part of that is what we've been talking about. Men don't go to the doctor.
Okay.
You have to go to the doctor to get a script.
Another thing I'm starting to hear a lot of folks talk about is being pre-diabetic. What does that mean? And is there, if you are pre-diabetic, does that mean you should be on any kind of medication to manage your diabetes? Or maybe you don't have diabetes if you're pre-diabetic.
Pre-diabetes is not diabetes yet, but it is the path to diabetes. These are people who, and we have blood tests that tell us that you're not normal, but you're not diabetic yet. And someone who is pre-diabetic, the figures are, if someone's diagnosed with pre-diabetes, generally they will become diabetic within 10 years, unless they do something radical to change. And that involves diet, weight loss, weightlifting. Exercise is good. Weightlifting, that exercise is really, really good. Building muscle mass, which actually helps to absorb blood sugar. The CDC and others have said we should use prediabetes as a warning sign, and then heavily coach that individual to try to prevent them from developing diabetes. We have a much better chance of preventing someone from becoming diabetic if we catch them before they get pre-diabetic. And then if we catch them when they're pre-diabetic, we can still prevent diabetes. But once they develop diabetes, it is very rare that they undevelop diabetes.
Can you live, barring something unforeseen, if you have diabetes and hypertension and you choose not to take medication? Can you live a long life, not treating diabetes or hypertension?
It is possible. It's not likely to happen. Someone who has diabetes, who then starts a very low sugar diet, high in protein, lots of exercise, you can get some distance from that. But the problem is, if I have 100 people who have diabetes who are 60 years old, I can tell you over the next 20 years, a goodly number are going to end up having kidney disease because of their diabetes and end up with dialysis or kidney failure and die. A goodly number are going to go blind because of diabetic retinopathy. A goodly number are going to have strokes. A goodly number are going to have heart attacks. A goodly number are going to lose limbs because of vascular disease. If I treat the diabetic, and the treatment can include a number of pills that are advertised and some that are not, as well as these injections that we were just talking about, and if I can encourage some weight loss, I can lower the risk, not to zero. I can lower the risk of all of those bad things happening. And that's one of the reasons why we like to see everybody see a doctor once a year and have a sort of health coach to help with these sorts of things if one is pre-diabetic or on the road toward diabetes, or if they have diabetes, get it actually treated.
What's the connection, doctor, between diabetes and then having a heart attack?
Okay. When people have high blood sugar, they end up having the old folks used to call it hardening of the arteries.
Right.
We collect cholesterol plaques in the coronary arteries. These are the small blood vessels that provide blood to the heart muscle. And literally, a heart attack is when one of those arteries gets clogged and blood can't flow through the artery. The muscle that would have gotten the blood flow and the oxygen, but now does not get blood flow and oxygen because of the clog, dies. That's what a heart attack is. And we do things like angioplasty, which is literally this is plumbing. Angioplasty is literally a roto-rooter procedure to
Right.
actually clear that clog
Hold
out.
that thought for me, doctor. I do want you to further explain this connection between diabetes and a heart attack. I also want to talk about supplements and herbal treatments that a lot of people use in lieu of going to their doctors. All right, Dr. Brawley, you were describing what happens when you don't treat your underlying diabetes. It can create what you said we used to call hardening of the arteries that obviously could lead to a heart attack. Do you think enough people know that? Because I know a lot of people, again, with diabetes, it doesn't seem like people take diabetes as seriously as they perhaps should, given that it can cause so many other health challenges.
You are exactly right. And there are some people who believe that 15% of Americans with diabetes don't know that they have it. And there's a goodly number of people out there who have diabetes and are totally unaware. By the way, when I was describing where the stickiness occurs in the coronary arteries and you get cholesterol plaques, that's what happens in the brain that cause strokes. That's what happens in the legs that lead to people having to have amputations. Blood flow is obstructed to the legs, leading to necrosis. We call it necrosis. You would call it dying of parts of the feet and that sort of thing. But no, this is a huge, huge problem, especially in the Black community.
Wow. The other thing I want to talk with you about, obviously, another reason, as you said, to get your yearly checkup. So you are checking your levels, your blood levels, your all your panels, your blood panels, to make sure that if you are diabetic, you are getting the kind of medication that can help you manage.
The key here is go to the doctor for a healthcare checkup. Don't go because this hurts or that. Plan to go because I am feeling good and I want to stay feeling good, and have a good conversation with your doctor about what they want to do, and then decide whether you want to do it. And the doctor should respect what you want to do, because I cannot overemphasize, Black men especially walk out because people start talking down to them.
Yeah. I love that, though. I love the concept of don't wait until you're sick. Go to the doctor because you're healthy and you feel good and you want to keep feeling good. You want to stay in good health. Let's talk a minute, doctor, about supplements and herbal medicines, or I don't even know if that's a misnomer, herbal treatments of sort. Again, I had an experience with someone whose father is very, very ill. And they told me, oh, no, Dad's doing better because I gave them some supplements. And, you know, it's made him feel 100% better. And there are people who, with colon cancer, you'll hear people talking about doing cleanses to clean out their colon, and as if that's, you know, some kind of treatment for colon cancer. How serious is that? And I know as a you know, a trained physician, you probably worry when folks come in telling you about the supplements and herbs that they're taking. But is that an issue that we should be concerned about again? Men in Black, you know, Black men's health issue?
It's a big issue. There's nothing wrong with taking a multivitamin per day. Certain people, especially dark-skinned people, maybe should take some vitamin D and vitamin K on a regular basis, although I would prefer you see a doctor and a doctor tell you you need to take that. There's a lot of things that you see in the health food store and what's called the vitamin aisle at the drugstore that are totally worthless and they're wastes of money. And sometimes they can be worse than wasteless, worse than wasteful. For example, if you're taking certain types of drugs as blood thinners, these are people who already have blood clot problems. Some of those vitamins actually work against the pills that we prescribe. There are people who take certain drugs for depression. Some of those drugs work against the antidepressant. And so if you are taking these drugs, please don't hide them from your doctor. Let your doctor know so that your physician, he or she, can look to make sure you're not taking something that has a terrible interaction.
I'm so glad you said that. I'm going to remind this lady who told me this about her dad. Like, ooh, that's scary. Make sure your dad's doctor knows what you're giving him, because you may think this is helping him, but it could be, really interfering with the medication that the trained physician has prescribed for your dad's very serious health condition. A couple questions, doctor. A lot of folks go to doctors, and I'm sorry, we love you guys, but you like 2 minutes.
Yeah.
And people are intimidated because, they're afraid to ask questions, or if they do ask questions, they say, well, they're not going to answer the questions, or, an office may say, well, you're here for your leg, so I can't talk to you about your arm. What advice can you give someone? Let's assume we've been able to motivate a man to go to the doctor. What should they go into that appointment with armed so that they get the best out of that appointment?
Yeah. Go in with the questions you already want to ask. Ask for that question for a well visit, because doctors, by the way, doctors don't determine how much time they have to see patients. Administrators do. And the administrators actually give doctors more time in order to do a well visit than they do if you're going in because something hurts. If you're going in for a sore throat, they allocate literally 10 or 12 minutes for that. But if you're going in for a physical exam, they may give you 45 minutes. And so that's a way of getting more time to have a conversation. And that's a frustration for many doctors as well. We're losing doctors because they want to talk to their patients, but the administrators, give them so many patients in a day that they can't talk to their patients.